All right, so for the record, folks, today is August the 11th, 2024. It's a Sunday. It's a little bit after 5 o'clock Eastern Standard Time. My name is Jonathan Jones. My pleasure, my privilege to be your host and moderator for this afternoon. We're looking forward to a very interesting discussion with Dr. Prasad. As Bernard mentioned, this is World Cancer Awareness Month, the month of August. No, not cancer awareness, Cancer Support Awareness Month. So we're concentrating our thoughts here on cancer support. Last week, we spent some time talking about supporting cancer and supporting people who are dealing with cancer, especially those who are being slammed with radiation and chemotherapy. That's the standard today. So we'll see what Dr. Prasad has to say as to what how his formulas have such a huge impact on people who are fighting this condition, and what maybe some of us can do by sharing this information with those that we care about. So before we begin, though, just to remind everyone, the FDA has not evaluated the statements that we're making. You're going to hear testimonials. They're purely anecdotal. Results are atypical. That simply means that what happens to one person may or may not happen to you. Neither the Healthcare Support Association of America, Engage Global, Dr. Prasad, Jonathan Jones, or any other host and co-hosts or authorized representatives are making any claims that any supplements that we recommend will treat or cure any disease state. So this presentation is for information and educational purposes only. It is not intended to be a substitute for a visit to your primary healthcare physician. We strongly recommend that you seek the medical advice of professionals that you trust. So that's the official position that we take on this. But keep in mind, folks, that there's an ocean of information out there. And there are a lot of things that we haven't heard about. And we're very fortunate that we have access to people who are willing to dive in and do the research and bring it to the fore. The reason why it's so important is the screen you're looking at right now. The CDC, to this day, still reports that cancer is the #2 leading cause of death in this country. Now, they had COVID-19 on there as of last year, but I think they've removed COVID-19 off the list as the #3. #3 is accident or unintentional injuries, and what they mean by that is medical mistakes, iatrogenics. So it looks better to say it's an accident rather than to say that the medical system caused a problem, someone's demise, but it's the #3 leading cause of death in this country. So that should tell you something. There's two things you don't want. You don't want heart issues and you don't want cancer, because that could put you at risk for the #3 leading cause of death, and that's the medical system itself. So, and I'm not trying to make light of that. That's just a fact. But when it comes to cancer, you're looking now at the top 10 cancers by rates of new cancer cases in the United States. And these are just the latest figures that I was able to find. This just goes back a few months ago. They may have updated it by now, I hope. So by next week, we'll try to get you the most current information. But that's what they had on the CDC's website. So female breast cancers and prostate cancer for men, it's up there at the top. Then when it comes to rates of death, same thing: lung cancer, breast cancer, prostate cancer, they're all just up there. Preventable cancers, smoking, obesity, alcohol, UV radiation, all things that we can do something about. I dare say that alcohol, people aren't going to just stop drinking alcohol. I dare say it's very difficult, nearly impossible to control the obesity issue. Because that's just getting out of control, not just here in this country, but actually worldwide. It's getting worse, and it's getting worse, actually. Smoking has improved, but it's still the #1. And UV radiation, that's connected to our cell phones. And the World Health Organization says that cell phones may cause cancer. It's on the list right there next to cigarettes. But how many of us would be willing to part with our cell phones? I don't think very many would be willing to let go of their cell phones. Cancer is improving. I should say improving. Certain treatments for cancer is improving. There's still the top 5 treatment options is surgery, chemotherapy, radiation, targeted therapy, and immunotherapy. Maybe Dr. Prasad will give us a comment on these. But we like to just make sure everyone understands that when it comes to the side effects, they are very real. And we're not presenting any news flash here. Everybody knows that there's severe side effects that come from chemotherapy and radiation. Nausea, extreme fatigue, hair loss, common immunosuppressed, immunocompromised, because the immune system gets attacked. The immune system gets weakened by chemotherapy and radiation. So a person becomes open to all kinds of infection and other problems. Chemo brain, that's not an uncommon thing. Almost every person that I've ever dealt with fighting treatments of cancer with chemo all mention the same thing. They just cognitive impairment. They just can't think right, and they have to fight to focus. Their memory is shot. So we try to coach people to tell them that, listen, record everything, record what your doctor is telling you, write it down. Don't trust that you're going to remember it because you're fighting too many things. Take a snapshot of this screen right here, and this gives you a summary of all the different issues associated with the side effects of chemotherapy. And radiation causes a lot of these as well. Now, this is where the improvement has come. They've gotten these immunotherapies that have come along, and now they're talking about, I think they're in phase 3 clinical trials. Maybe Dr. Prasad can tell us a little bit about that, where they have developed what they call a vaccine for cancer. It's one shot. I think it's somewhere around $70,000 or something like that. But that one shot, they say, is targeted specifically for one person and their cancer. So they're making some progress. But listen, let's talk a little bit about, I'll talk to the gentleman who has forgotten more on this subject than most of us know, and that's Dr. Prasad. Dr. Prasad was the world's first radiation biology Ph.D. And you see the list of his accolades there is quite extensive. Because of his work, he's been awarded millions of dollars to back up his research. And the reason why is because, as you can see under his credentials there, he was the professor at the University of Colorado School of Medicine for some 30 years, and a number of other things, including being invited to be a member of the Nobel Peace Prize nominating committee. That by itself really should just end the whole conversation, because they just don't invite anybody to do that, folks. That's just serious. But Dr. Prasad has authored or co-authored some 33 books, it says here, but I think that number is more like 35 now, and has been published more than 250 times in peer-reviewed publications. And other scientists are making reference to Dr. Prasad's work on the government's official library of medical documents. This is just a snapshot of some of the books that Dr. Prasad has published. But now, we're going to tap into Dr. Prasad about some of his new research. So, folks, it's my pleasure and my privilege to introduce to our discussion now Dr. Prasad, and we're very fortunate to have him be willing to join us on days like this to talk to us a little bit about this very serious topic. So, Dr. Prasad, thank you very much again, sir, for taking time out of your busy schedule to join us to have discussions like this.
Thank you, Jonathan. I always enjoy being with you and our engaged team. And
yes, indeed. Well, tell me, why is this still a problem, Dr. Prasad? Why is cancer still the big thing, the big deal that it is?
Yeah, it is because, for example, like you mentioned briefly, there's diet and lifestyle changes and environmental issues. We can't control them. Diet, human behavior are difficult to change. So if you don't do these things, that consequences is cancer, is risk of cancer or incidence of cancer is increasing. And despite of all the new development of new drugs and innovative surgical procedures, and still the number of people who die every year is growing. And so we need something which can improve the current treatment and without any toxicity. And then another issue is, this is a cancer treatment issue, is that we have to improve so that we can have reduced side effects and improve the response rate and also quality of life after the treatment. And the second phase is what happens after therapy. Like currently, a lot of people are cancer survivors. What they should do so that because all the current cancer survivors have an increased risk of primary cancer, any cancer they had. Secondary cancer means new cancer development. And third is non-cancer diseases as well. And so how do you reduce the risk? And I was mentioning to Bernard that core 4 is a perfect for that kind of issue for prevention point of view, whether after therapy or before therapy, but not during therapy. And during therapy, Jonathan, that I have a different types of formula, high dose antioxidant, but as you know, they require investment, and finally, my goal is to get a FDA approval for this. But in a meanwhile, what you do, people are suffering from cancer, and that's why we recommend the micro daily EMF 3 times more than the preventive dose to act as a high dose antioxidant. It is not a perfect formula that we have, for which, as you know, we have a patent for that. And so in the meanwhile, we have to do something about it, And the best strategy I thought would be if you increase the preventive dose 3 times, it is not exactly the same, but it is a little bit better than preventive dose alone. And
Right.
so with that attitude, with that one, if you do it before you start treatment or during treatment, doesn't make difference. But the best thing is to apply 1 week before the treatment, and so that tumor size regress. And the reason high dose antioxidant is very effective with no toxicity is that cancer cells require 2 nutrients for survival: glucose and glutamine. And if you block either of them, then they will die because they can't function without those 2 nutrients. And so what high dose antioxidant does, it not only blocks the glucose uptake, but it also blocks the metabolism of glutamine. And if glutamine is not metabolized, it is useless. And because this is required for the synthesis of vital molecules that cancer cell need to survive. So it works by total mechanism which are different than chemotherapy and radiation. Chemotherapy and radiation works by generating free radicals. And therefore, if you generate free radical, they kill more cancer cells, but they also kill normal cells. But with our strategy, it is very selective for cancer cells. So if you combine them both, it has 2 advantages. One advantage is further improve the tumor response rate, because as you know, it is not 100% goes away after chemo or radiation therapy. And second thing, that it will prevent or reduce the toxicity of chemotherapy, of radiation during treatment. And so with that intention, I think this is fantastic things, and people who are using this kind of a strategy, what we report in the past, few people that reported it, actually several people, that they are getting a lot of benefit from this kind of a strategy, because it is a non-toxic approach. It kills selectively. Even sometimes, as you know, tumor becomes very resistant. After certain treatment, tumor doesn't respond anymore.
Right.
And so because what happens, the cancer develop all antioxidant elevation, like glutathione elevation happens, and then they resist because one of the main cause of damage is free radicals. And if you have cancer cell acquire a high level of oxidative antioxidant, then they will resist it. But if you give them high dose antioxidant, it doesn't make difference to them, because high doses of antioxidant will block glucose, glutamine, and no matter, as long as you are cancer cell, you are going to die. Normal cell don't die at all by this mechanism.
Wow. Wow. Dr. Prasad, that's interesting, because we're hearing talk now in the news and in the science circles about turbo cancers. They're saying now that You gave us a presentation and told us that cancer could take anywhere around 20 years between the cancer promoting agent,
Yes,
contact with
exposure.
cancer initiating agent coming in contact. So, but they're
Yeah,
saying now that the time period is not 20 years anymore. They're saying now that some cancers are
yeah.
developing.
Yeah, for example, if you have some, like people are developing vaccine, you can develop vaccine, for example,
Yeah.
if you know what is the agent against which you are creating a vaccine. And vaccine you can create if it is a viral origin, because certain types of viruses cause cancer. So you can
Okay.
develop, yeah, you can develop the vaccine against chemical-induced cancer.
Okay.
There is nothing there. The antibody has to bind with some antigen, which is a virus in this case.
Hmm.
So, like for young people, which has a young female has a risk of, if you get infected with certain kind of virus, they have a risk of developing a cancer. And so you can develop a vaccine with that one.
Okay.
And another thing is, so it is not for everybody. It is not for all types of
That's
cancer.
it. That's important to know right there, Dr.
Yeah,
Prasad.
yeah.
It won't
Because
match everybody. Okay.
no, because virus needs some antigen. An antigen is represented by not the chemicals, but it's for living organisms, something like virus.
Okay.
Bacteria doesn't cause cancer, but a lot of virus which causes cancer. And
Right.
and so and gene therapy is being developed. And but see, it is impossible when everything fails, chemotherapy, radiation, then they go to gene therapy.
Right.
But that's actually not a good from scientific point of view, because by the time the what do you call cancer cell have developed so many mutation, so
Yeah.
many normal genes,
Yeah.
and you have a drug which affects only one or two kind of genes, is not going to do very much. Plus, it has a lot of toxicity, and so that has not been very successful at all thus far. And uh, and as far as the immunotherapy is concerned, idea is good, but immunotherapy cannot be successful if you are using a drug. Immunotherapy is that, suppose if you have a melanoma tumor, and from the same tumor you homogenize and develop some kind of a extract, and then you inject it, that is effective. Actually, one of my friends had it. But if you have a classical drug from a different types of tumor, not even different types of tumor, it is not going to be effective. So immunotherapy is good if this therapy is made in by your own tumor. Then
Ah.
this is very effective. A friend of mine here, who has a melanoma, went to the doctor, and at that time gene therapy was earlier stage, so they took his tumor to melanoma tissue and extracted the active ingredient and injected them back. He was cured. So
Wow.
immunotherapy is a powerful tool, but
Okay.
if you know it is from your own
Right.
tumor,
Okay.
not from somebody else's tumor.
Okay. All right. So it's got to be very, very, very specific. That maybe that's why it costs so much money. So then, how about this, Dr. Prasad? We've got a couple of examples of exactly what you said. Some pictures, and I'm curious to get your comments on the pictures. I think you've heard
Sure.
these stories before, but we've got some folks that are here for the first time that have no idea, anything about how powerful uh, your your formulas can be. And for those who are here, if you're sensitive in any way, shape, or form, and don't want to see an open wound or or anything that depicts cancer, now would be the time to look away from the screen because we're going to be showing an open wound, and this is active cancer cells. All right, so just consider yourself warned. So, Dr. Prasad, this document right here
Mhm.
came from Ecuador. This is a woman who was down in Ecuador. This is April 2024, and her
Mhm.
official diagnosis was melanoma.
Mhm.
So it was Charlie Rayford that told us about this case, and said that what we see there on the screen is almost exactly what it would look like in English.
Mhm.
Um, can you describe how it is that this would manifest on someone's foot like this? Because, to most of us, this would just look like a sore, like the person got their foot cut or something.
Yeah, yeah. I mean, once the cancer is melanoma and once they get metastasized, that is a symbol, very symbol of either metastasis or local cancer, which become big and
Okay.
breaks up, and then you have a hole there.
Okay. Okay. So this
So
is,
I think most of the tumor, melanoma tumor, is localized in the start in the beginning, but if you don't take care of that, then it becomes bigger and then will breaks up, and then you see the hole.
I see. I see. So this was not cared for a while and it just chewed away.
Yeah. They didn't may have thought, you see, oh, there's a wound, but
Yeah.
actually it was melanoma, and they grow and then breaks up.
She described that it was extremely painful walking, painful going up and down the stairs, and the doctor said that she actually might lose her foot. They were going to amputate. They were talking about amputating to save the rest of her life.
Mm.
So it was a pretty bad situation. So anyway, she began taking your formula, and as
Mm.
you said, we don't have your high dose one, but we do have the high dose micro daily EMF.
Yeah,
That's high dose antioxidant. So she began taking it. What are we looking at here, Dr. Prasad? Because that was kind of oozing and soft.
that look like a healing up, and tumor is shrinking.
And I'm told, Charlie said that this was about 1 week, 5 days after
Really?
you started
Mm.
on your formula. So this is 5 days
Huh?
after starting on high
Amazing.
dose antioxidant.
Amazing.
Yeah.
Amazing.
And then about 2 weeks later, this is what it was.
Wow.
This is
Wow.
day 14.
Huh. I think this should be, if the doctor who is looking at it, they should be reported as a case, a study, and it can be published very easily if the oncologist allows it.
The biggest problem, Dr. Prasad, it seems like oncologists are just not excited to go on the record about this. And I can't understand that. Well, I do understand it because, their license puts them in one area.
Mhm.
And if they turn around and now say that some natural thing did this, does that put their license at jeopardy?
Oh, I see.
So they're having a hard time. We're just having a hard time getting them to sign on to stuff like this. But that's 2 weeks after being on your formula, Doctor. High dose
I mean,
antioxidant.
even the doctor does not permit it. One can try to see if they will publish it without doctor, as long as the patient is writing down and picture is there all the time interval. At least I can try it.
Okay, well, I think we need to get that information for you, sir.
Mhm.
So, for those who are
That's
here,
amazing.
looking at this, Dr. Prasad, is this illustrating exactly what you just told us in theory should happen? That if a person is taking high dose antioxidant, it would starve the cancer cells?
Yep.
Okay, well, we got another
Yep.
one here. And this is the full 2 weeks right here.
Uh-huh.
As it healed up. And the last time we had conversations about it, she's back to normal. She's running up and down stairs, walking up and down mountains like nothing anymore, like she never had a problem.
Uh,
It's mind-boggling, isn't it?
it is amazing.
And it got the dates and everything. This was May the 2nd. May
And I
the
think about those darker spot, what is that? Still is melanoma or
I
something
think
else?
it's just subcutaneous. It's just some broken blood vessels just below the surface.
Yeah. No, but the most important thing is just almost healed.
Almost
The
completely healed, yeah.
yeah.
He hasn't sent any pictures as to since this, but that actually happened. There's another case that Beth shared with us, and we talked about it a little bit last week. I mean, look at the difference here with this one. This was April the 18th to May
Hmm.
1st. This is just a summary of the entire case with that foot.
Can you? My son is a cancer expert. Can you send me this photo if it is
Yes,
possible
I'll
to me?
send you these. We'll
I
send you
will show
these
him.
slides. We'll send you these slides with these dates and everything on it.
Yeah, perfect.
Yep, we'll make sure we do that for you.
Where is this patient from?
This patient is in Guayaquil, Ecuador.
Ecuador. Okay.
Yeah. This gentleman here was,
Yeah, that's in that one. Yeah.
you remember this man.
Yeah. Same
It's
story.
basal cell carcinoma, big old hole in his face, untreated.
Yeah.
Um, they decided to put him on. He was taking, I think, 33 rounds of radiation, right?
Radiation therapy, yeah.
Yeah. So they hadn't started him yet on that, but the minute he started it, he started a high dose of
Mm-hmm.
your product, your
Mm-hmm.
formula.
Mm-hmm.
This is what happened. Just the time difference was August to November.
Yeah, that's amazing. Nobody
This,
would believe it.
this is where the problem
But
was right
see,
there,
that's the
Dr.
thing. This is, people are oncologists are afraid that if this kind of procedure get approved by FDA, say for example, my formula, which is would be much better, much quicker response, and that their business might be, or drug company might have a problem. But I'm saying that you're combining it with it too. So I'm not
Combining.
challenging your treatment modality. I'm simply add on.
Yeah. Yeah. Just add it to it.
Yeah.
That's pretty amazing, Dr. Prasad. So
I,
anyway, for those who are here with us, then
these two together can be with the date and everything. I have a picture, but I don't have this detailed name and the treatment and dates, which is very important. And so I think this makes a difference. These two pictures, I guarantee you, we can get it published with
okay,
these
well,
two patients.
then we will want to get the word out then, Dr. Prasad.
Yeah,
So
and get the permission from these guys, and then you, me, and I think Beth is involved too in the
yeah,
beginning.
we
And
will make
anybody
sure,
who's involved can be a co-author with me.
Dr.
And
Prasad, we're going to make sure that this happens. And but for those who are here looking at this, they have to be surprised, Dr. Prasad,
I
and
know,
in disbelief.
I'm surprised. It's unreal.
But I mean, you want your loved ones to know about this. You want
I,
the loved ones to know about this. They want to just tell somebody there's something they can do. My brother-in-law right now has a cancer, and same thing. We're working to get him on your high doses of your formula. He says he can't drink a lot of water, so that's his big excuse right now. So, but we're going to try to work around that to make sure that he does get started on your formula, high doses of it. This woman here was very similar, Dr. Prasad.
Mhm,
She had breast cancer. She
mhm,
had surgery. She also had 8 rounds of chemo, and she had 33 rounds of radiation. But during the entire process, she was taking therapeutic doses, as you suggested,
mhm,
of microdaily hydro or EMF, one or the other, whichever
mhm.
one they had available at the time. And in her words, her story was that she had no side effects. She had no pain. She had no hair loss, just like with the other ones. They had no
Yeah,
hair loss, no
yeah,
pain, none of the common side effects that came from the treatment. So the list really just goes on and on and on, Dr. Prasad.
yeah.
And I think you've helped us to understand it, but could you tell us a little bit about how and why the side effects are ameliorated? Can you help us to understand that a little bit better?
Yeah, because see, since they cause it damage by free radicals, chemotherapy and radiation, and then high dose antioxidant, even though their main function is for cancer cell, reduce it, but for normal cell, they said, okay, free radical damage you are producing, you are not going to hurt. So antioxidant traps all those free radicals, and therefore you don't have any side effect. In other words, antioxidant, whole body has a high dose of antioxidant.
Okay, so the
And
toxins, the treatment itself is
yeah,
toxic. You know that.
toxic produces a lot of free radicals.
So
And free
those free
radical is demanded.
radicals,
Yeah. And antioxidant destroy the free radicals. So to normal tissue gets protected.
okay,
But it might do the same thing for cancer cell, but cancer cell is dying not from the free radical. Cancer cell is dying from the lack of nutrient, to
being
glucose and almost a starvation.
starved to death. Okay, so they're going away and they're becoming more susceptible to the free radical.
Yeah,
Okay, I mean the free radical can
almost. Yeah,
the cancer cell a little bit better, so
yeah,
that will make it respond better.
yeah.
And all those side effects, all the damage being done to healthy tissue, those
Hmm.
cells are being protected.
Yeah. And for free radicals, cancer cell is dying from the from the lack of nutrient. Therefore, it makes a difference whether you give them free radical or not free radicals.
Wow. Wow. That is just mind-boggling, Dr. Prasad.
But free radical for normal cell, free radical is damaging. So if you block them, then this will be will produce protection.
It's just so simple. That's so simple.
Very
Okay.
simple. I mean, the idea is so simple that nobody wants to believe it. You know,
We're expecting something complicated here,
I
Dr.
mean, when I propose this hypothesis, when I find as you know, high dose antioxidant for a long time, I've done published a lot of research, but I didn't know how it works. And therefore, I could not explain it. It does not work by free radicals, protecting free radicals. And so that will be counterproductive. But then finally, when I did more research and found out, oh yeah, high dose first ask question, why cancer, what cancer cell needs to survive? So I started looking at the research and found out, oh, cancer cells require glucose and glutamine, otherwise they will die. Then I said, maybe high dose antioxidant does the same thing. So I started looking literature on that one, and sure enough, found that high dose antioxidant will kill a cancer cell by blocking the glucose and glutamine. And so I said, perfect hypothesis. But there was a hypothesis,
right?
And so, but nobody has tested that until we started testing with the interim formula, not my real formula that has been patented. But I think I felt that I have to do something for a patient who has right now cancer. And I said, okay, this could be, and I always say, consult your oncologist. So, and again, I'm not trying to replace their therapy. I'm trying to enhance their therapy.
Yeah. So take a screenshot of this one, folks, right here. This is the one you want.
Yeah.
This is the summary of Dr.
Cancer cell, no matter what kind of cancer cell you have, not what a stage of the cancer cell is, what a stage of treatment you are in. If you give them a high-dose antioxidant, they will kill that by preventing the glucose and glutamine.
So, and it doesn't matter what additional treatment is being recommended. You can take this along with any treatment that's being
treatment you're
recommended by your oncologist. They can take this along with it.
Or gene therapy, any therapy you are taking, that's okay.
Okay.
Does not interfere with that.
Okay, that's wonderful. Tell us a little bit about how MicroDaily works. Just give us a summary of this, please.
You see, this is a preventive dose, as you know. So take example of vitamin C. 500 milligram is per dose. So actually 1,000 milligram you get every day for prevention. And if you put it 3 times, you have a 3 grams. In my formulation that has been patented, I have given a 5 grams. But the same thing is, for example, vitamin E. We have about it is in a milligram, but it is in a 400 international unit, 200 each. And in my form, so 3 times would be 1,200 international unit. My formula has 1,600. So my formula is also much more effective. But in the meanwhile, tested this one, and it looks like it is at least reasonable, effective.
Oh, yeah. Well, it's definitely working because it's got everything in it that you need.
Yeah, everything that you need, except that we have given for example, in my formula, I given only vitamin E succinate because vitamin acetate has no role in preventing the uptake of this. So there are 2 minor modifications, except that one, everything is same.
So then for everybody who's on this meeting right now, why is this particular product then a very good one for someone who wants to support someone with cancer right now? They're going through treatment.
Yeah, because as I said, this has almost all
this is everything
that has been used in human for preventive purpose. So we know that.
There we go.
Yeah.
Okay, there we go.
Yeah.
And in addition to down here, Dr. Prasad, am I with this? We got N-acetylcysteine, alpha-lipoic acid, all things that help to enhance glutathione.
Yeah,
and make
exactly. These are all antioxidants. They will all enhance And if you increase that by threefold, this will be very close to my formula, but not exactly same. But
Fantastic.
still, the fact that it becomes high dose. Anytime you increase the current preventive dose, it becomes high dose.
That's right.
But every time I just guessed it, I said roughly 3,000.
Yeah.
That would be close to that.
We've had some people taking 4 times the amount, Dr. Prasad, 4 times. Yep.
Yeah.
So
So
very
again, it is, and again, you don't take all your life. It is taking only cancer treatment is around 1 month or 6 weeks, generally.
right. And then once they're declared cancer free, they can begin to slowly taper it down.
That's right. And another thing, during cancer treatment is very important, which I have not included in my patent, but it is extremely important because at that time I didn't know that. And because all cancer cells, people who have a cancer, have an intestinal dysbiosis. And if you are getting a chemotherapy and radiation, they further enhance the level of intestinal dysbiosis. Means you have much more toxic bacteria than you had before. And not only that, this intestinal dysbiosis means number of harmful bacteria increases in your gut and beneficial bacteria decreases in your gut. This is what we call intestinal dysbiosis. And dysbiosis is not only during treatment, but it reduces the effectiveness of chemotherapy and radiation therapy. That's amazing.
Yeah.
It increases their toxicity.
Wow.
And still, unfortunately, oncologists never ask, how is your gut? But this has been well established, and I published a paper, as you know, on this issue. I don't know whether I sent you or not, but if not, I will be glad to send it.
Oh, yes.
Intestinal dysbiosis in cancer treatment. And that's amazing how important it is. So we also recommend, in addition to high-dose antioxidant, you also must take probiotics daily. The only thing I don't recommend there is collagen peptides.
Right. We're going to get to that screen here in just a minute. So for everyone who's listening in carefully, so far, Dr. Prasad's recommendation, at a very minimum, for those who are dealing with, who want to support someone with cancer, they got to be on microdaily EMF. Any one of the microdaily formulas, but the best one is the microdaily EMF formula, along with this probiotic daily. This is all the heat resistant and all the acid resistant strains of
That's right.
So this one here is the best one on the market so far that I've been able to find.
Yeah, exactly.
Omega-3 is also very good for someone who's dealing with
Omega-3 is good for your health, but has only one thing is the omega-3 can prevent it, that the cancer patient have a high oxidative stress.
Right.
And omega-3 is very important for your heart health and brain health.
Okay.
DHA is more important for your brain, and EPA is more important for your health. And so this is very important. But what happens in the presence of high oxidative stress in your body, the omega-3 gets easily oxidized by free radicals, is easily damaged by the free radicals. Then it is there, molecule is there, but it's not functional. So if you get a supplement, then it replaces the damaged probiotic, omega-3, and then you are okay. So it is also very important to take omega-3 daily while you are having a cancer.
Does it make sense to Dr. Prasad that this would help with, because I've heard of some cancer patients getting neuropathy from chemotherapy. Would this also help with that?
Yeah, because DHA is so important. 40% of fatty acid in your brain. Brain has a lot of membranous structure. That means it requires a lot of fatty acid to make a membrane. And membranes are very sensitive to free radical damage.
Right.
They get easily damaged. And so that's why it is so important to have omega-3, that they get oxidized or damaged by free radicals. Omega is replaced by the good omega daily, and therefore it could be helpful in your peripheral neuropathy. Yes.
Gotcha. Wonderful.
With
This
cancer
is one here. This is the one here you said that's better for someone who's fighting cancer not to take this during cancer treatment.
No, yeah. Not only cancer treatment, not for prevention percent is okay, but not for the if you have already active cancer.
Right.
Before treatment, after treatment, collagen is no. And the reason is no, because what happens, it places barrier between immune system, which sometimes sends tumor cell killing lymphocytes to reduce the number of tumor cells so that they grow slowly. But if you block it, that migration of cancer killing lymphocyte from immune system, then cancer cell will grow more rapidly. So that's why we said
Okay, so we don't want to help the process.
collagen peptide.
Yeah,
If you
we
have
don't want
any
to help
kind
us.
of cancer, no collagen peptides.
Okay, so we want them to wait until after they're declared cancer-free, then they can start on collagen
Yeah,
peptide.
then when you're cancer free, then yes, exactly.
Okay, so for the rest of us though, I'm loving this stuff. That's all I got to say about that. This stuff is phenomenal. Great for the skin, great for I feel my brain is doing really well on this stuff.
Not only brain, but also I just published a paper that in a year, people who go to older, they
Yeah,
also have a hearing problem.
yeah.
And when they look to hearing problem, they see a lot of damage to the collagen peptides
Oh, wow.
because they have three different types of collagen 9, collagen 4, and collagen 6. And all they have different function in a ear so that they maintain a normal ear. Some of them allow a good flow of blood. Some helps them, and some are very structural. Ensures that a structure is not abnormal, and so it is very important for prevention and for prevention of hearing disorders. Very kind.
Wow. I did not know that. That's good to
Yeah,
know.
I didn't know either. When I was writing this paper, and most of my friends of my age have a severe hearing problem, except me.
Well, now we know why.
Yeah,
So,
I mean, these are research done in isolation, like for example, just collagen peptide and hearing disorders.
right.
But they don't put all things together because hearing disorder, you also have antioxidant, you also have, if you have hearing disorders, you also have some other disease,
Hmm.
intestinal dysbiosis, you have to correct them.
Hmm.
And so in that paper, I supported the idea of a core 4,
Right. I got you. I got you. All right.
prevention of hearing disorders. Yeah.
So this is the bundle. And only for those who, if you're dealing with cancer support, of course, you don't want to go with the core four for the collagen. You want to go with the premium bundle. But just in general, then for everybody else, for all the rest of us, then who the
Yeah.
core four is the way to go.
Yeah.
And this month, the digestive boost is being added in. Is it the sleep boost?
Yeah, I think digestive boost is so important also for Alzheimer or prevention of Alzheimer or Parkinson disease, because this is mostly older people suffer from Alzheimer and Parkinson disease, and then older people also have reduced capacity to produce digestive enzyme that
Yeah,
they generally produce.
yeah.
And then if you don't produce it, then you can't digest it. If you can't digest it, you have feeling of bloating. And also important thing is that during digestions, cancer-causing agents and other toxic chemicals are formed in the gut. So if they're not being eliminated, then they will stick there and they will gradually absorb and create all kind of health issue.
That's
And
not
so
good.
so it is very important to have a digestive boost that makes you sure that everything is digested. Once it is digested, it is easy to get out through the feces.
Gotcha. So those who are having the chemo brain, this would be great for that.
Except exactly. And the reason is because here we have added a curcumin and resveratrol first. Those two are very, very important for generating energy. And resveratrol has the additional importance because it also increases the formation of new mitochondria.
Oh,
And mitochondria, as you know, is the one which generates energy, picks up oxygen, and goes through and require coenzyme Q10 and also vitamin B3, which is niacin. And so that's why we added those two, because it is so important. One for powerful protection, because brain is exposed. 20% of respired oxygen used by brain.
Mm.
And brain has the least amount of antioxidant defense system, means antioxidant compound as well as antioxidant enzymes. And so it is exposed to. And then at the top of that, brain membranous structure, very sensitive to free radicals. So you are producing free radicals, mitochondria is producing. At the same time, not only damage the structure, but mitochondria themselves gets damaged
Oh
because,
my goodness.
yeah. And so that's why I said, okay, we will provide some additional antioxidant to brain. And that's why we provided the curcumin and resveratrol. And people should know about this kind of issue, what is happening in the brain. Once you know what is happening in the brain, then you can take care of the problem.
Do something about it. My goodness. Yeah, I take one or two of those in the morning and one in the evening. Absolutely phenomenal. If
Yeah,
I
I
can't
mean,
even
you
start
know,
having a conversation
because
with
nature,
you.
I don't know why nature did not provide it, and probably what happens, and that's main reason why after the age of 20, you start losing neuron 1% per year.
No, I know some people that are younger than 20 that don't have neurons, Dr. Prasad. So I think it's in, I'm just kidding, but
No, but the thing is that
I'm just talking about.
plasticity somehow, by the time you lose, it's too late to reverse it, and
Mhm.
then you develop all kind of neurological diseases. And
Okay,
so,
okay.
for prevention purpose, I said anybody who's after, let's say, 40 years age, take core 4 and brain boost.
And brain boost. Do
Yeah.
not leave out brain boost, folks. I'm telling you right now, this is not the one you
And
want.
digestive enzyme, you start once you are over 50, then you start digestive enzyme.
Yes, indeed. Yes,
And
indeed.
sleeping boost can be used by anybody,
Yeah, yeah. Even
because
children.
sleeping boost is so common. You have anxiety, depression, even high school kids have a problem of, friendship, relationship, grades, and all these kind of things. So, but many people don't get, or not everybody gets sleep problem, but some kids do.
Yeah,
This is very important for them.
that's
And
right. Right.
and older people, especially most of the older people, have a sleep issue. And so I think I take myself sleep boost,
Oh, yeah.
and also I take CBD. But here it is sleep big formula that CBD boost, because CBD boost is such a
I take both
agent
of these every night.
of them. See, one of them will calm you down,
Hmm.
but it increases the serotonin level in your brain. It increases dopamine level brain. That makes you happy and quiet. And
Yeah.
when you take a sleeping boost like melatonin it provides you deep sleep for longer period of time.
Yes, sir. Yes, sir. If I wake up now, I go right back to sleep. I have no
Yeah.
problem.
I mean,
So
I used to take it 10 minutes to go back, but nowadays I go back to sleep within 2 minutes.
right back to sleep. So, and I increase it. So if I'm having trouble sleeping, I'm really stressed, I'll take more of these. I'll take 3 sleep and 3
Yeah,
CBD.
again, these are very non-toxic. That's
Yep.
one thing. Good thing is non-toxic.
My goal is to get 8 hours of unbroken sleep every single night. So, but
Hmm.
uh, but Dr. Prasad, thank you for providing the detail that we need to be able to understand why these products are important, and that Engage Global is not just pushing products. There's a reason for this. So
Yeah.
for those of you who are on this meeting now and you have a guest here, or you have someone that you want to share this information with sometime in the future, just be thinking in terms of this bundle right here, the Core 4. If you took all the ingredients on the labels, it would be more than $1,000 to get all the ingredients that Dr. Prasad has put together in these formulas. But you don't have to do that. You get all of the net result of his research. If you purchase it retail, it will cost $310, as you can see. $310.62 to be exact, if you purchase them all retail. If you purchase them wholesale, as a distributor or as a preferred customer, it would be about $230. So Engage Global has stepped up to the plate and really is subsidizing our health. And they've reduced it even more. So if you buy it as a bundle, you get it for $199.99. If you get the hydro version of the EMF, then it's maybe about $5 more to substitute that. And then of course you can add on any other boost to this so you can add on any other boost items to that. For this month, the company is going to also give us the sleep boost for free. So if you do decide to get the Core 4, you're getting an additional sleep boost. The retail value of that will be $53.32. Absolutely free. Just make sure you call the order in, and the customer service rep will make sure that the sleep boost is added to the formulation. But keep in mind now, for those who are trying to support someone with cancer, Dr. Prasad has recommended for a minimum, as an absolute minimum, the microdaily EMF and the probiotic boost. Absolute minimum. This is the bottom line. But if this is all a person who is being supported by cancer can do, this is the one they want to support with, okay? And then if they're fighting the problem, then you want 3 of the EMF. You want 3 of these, okay? 3 times triple, 3x. Triple the normal amount if a person is currently going through some form of cancer treatment. We're not claiming that microdaily or anything else that has been discussed here is a treatment or cure for disease, but it certainly will support someone who is being treated for any of these diseases, okay? Particularly cancer, since we're talking about World Cancer Support Month. But these are the bundles right here. The basic bundle is the one we just described at the bottom as a bare minimum for someone who is fighting the cancer. But you just get back with the person who invited you to this discussion, and they'll help you sort through all of your purchase options with this on this issue. Okay, so that'll be your least of your problems. Now, next week, this month of August is World Cancer Support Awareness Month. We are talking about this subject again next month. But you know what? We're going to also talk a little bit about the emotional component of this, because sometimes negative emotion can have a very harmful effect on someone. If a person is
fear, anxiety, depression,
I remember the day that my younger brother-in-law, my older brother-in-law right now is fighting cancer, but my youngest one, when he was fighting it, when the doctor, and I don't want to completely blame the doctor, but I do blame the doctor, took away his hope, that was the end of his life. He was done. So there's an emotional component to cancer. So we're going to try to splash that in a little bit next week too, for those who can join us next week. So Dr. Prasad, once again, sir, thank you. And we really can't thank you enough for all that you do in helping us with this. We have someone here who is telling their story in the chat. I can't see exactly who that is. That has been cancer-free for some 12 years. 12 years. And bravo to anyone who's been cancer-free for that long, because they say that, isn't it about 5 years, Dr. Prasad?
Generally,
Is what they hope.
After 5 years, if you have no cancer, then you are cancer-free.
That's a pretty good thing if they are. That's Monica Patterson. Is that you? Go ahead, Monica, please share your story. We just have a couple minutes left. Well, we have a couple minutes. All right, we'll read her comment here. She says, we'd like to hear it directly from you, Monica. So if you can unmute, go ahead and do so. But she says, I'm cancer-free for 12 years. She lost 4 ribs to radiation therapy. And 4 rib bones. They are deteriorating briskly. Has an open wound at present. There are 2 years. Wasn't closing until I started using microdaily. Okay, so she had this open wound around her ribs. It was deteriorating, and for 2 years it wasn't closing until she started using microdaily. About 3 months now, the wound is about 3 inches, 3 by 2. She lives in Guyana and find it hard to order. I have orders from other people, and person who invited me is not helpful. I'm talking to a lot of people. Okay, so we're gonna try to help Monica out. So she's down in Guyana. So all right, well, there we have it. Okay, folks. So Dr. Prasad, thank you again, sir.
Sure.
So much for taking the time to join us on days like this and giving us such a huge variety of information that
I get excited.
we could take it to the bank. And we'll share some more stories with you next week, and we look forward to
Okay.
your additional insights. So come back
Okay.
next week, folks. Listen, everybody, if you know one person who could have benefited from this discussion this week, bring them here next week. We'll be talking to
Yeah.
Professor Prasad again
Yeah.
next week, everybody. You